Perfect. Thank you so much for the introduction. So it's really great to be here to share with you some of the work that we've been developing in East Surrey over the past, I think we sort of really got going in about December 2020. So I thought I would start by giving you a bit of background around how we got going. And I think I can probably trace the origins to the idea to conversations that I was having in the coffee room at work at Smallfield Surgery with the senior partner of my practice. And we were talking about how so many of the patients coming in to see us had conditions that could have arguably been prevented through concerted action at a local level. And we were hearing very similar things over and over again. For example, people telling us that they wanted to maybe improve their dietary habits to help their mental or digestive health, or as a family to help their child's obesity. But actually people couldn't afford to buy fresh food or didn't have the cookery skills to be able to cook it. Or as another example, people were talking about how they wanted to be more physically active, but they couldn't afford to go to the gym, and there weren't any cycle paths locally, and the pavements were very narrow. So getting their child to school or themselves to work was just really challenging. And Michael and I sort of challenged one another really to say, is it good enough for us just to hear these stories again and again and again over many years? Or do we actually have almost a moral obligation to go outside the comfort of the four walls of our surgery into the community and to see what we might be able to do to respond to these common themes that people were raising with us? And Michael, being the incredible leader that he is, thought we should go for this, and we decided to, and we linked up with the chief executive of our local GP Federation, Alliance for Better Care, and we met with 12 head teachers, who you can see in the top left-hand picture of this screen, and over a lovely lunch. It was absolutely fascinating to share our stories and to hear how the same issues that we were being confronted with by our patients' stories in our surgery were very similar to the things impacting on educational opportunities in the schools. And a few weeks later, we organised a bigger meeting in the local community, to which we invited people working for the local councils, local charities, patients and citizens, and people from faith sectors and many other backgrounds. And we were able to all share our concerns about the things that we were hearing and experiencing, but also share our collective dreams and our visions for how together we might be able to do things differently. I also ran an action learning set for GPs, and so these community conversations were supplemented by conversations between a number of healthcare professionals in our patch. We unfortunately had to then jump onto Zoom because the pandemic struck, which did delay things somewhat. But we were able to really bring together this co-created vision, which was that as a local community, we wanted to collaborate with people living and working in our area to cultivate conditions in which health and well-being could flourish for everyone. And right from the beginning, all of our partners, from local citizens to schools as well as health, were really committed to trying to do this in a way that improved health equity. And the other similar commitment that we had across all sectors was our commitment to the sustainability agenda, recognising that so many of the steps that we needed to take locally to respond to the climate and ecological emergencies were also the same steps that we needed to take for population health and health equity. And even beyond the environmental sustainability agenda, we in healthcare recognised that this kind of preventative model had the potential to perhaps help to shift healthcare away from a reactive model towards something slightly more sustainable or even regenerative. Our work is based on the huge evidence base on the wider determinants of health. This figure is taken from the Surrey Heartland's website, and you can see that, as I'm sure most of you on the call are aware, clinical care actually only contributes to about 10 to 20% of the variation in health outcomes. So by far the greatest impacts on variation in health is not from what happens within the walls of our surgeries and hospitals, but actually from what happens outside. And that, of course, encompasses our lifestyle behaviours. But we know that these are actually influenced by socioeconomic factors and by the influence of the built and natural environment. And I think it was the formation of primary care networks that really helped to provide a springboard for us to see that we had the potential as healthcare professionals not only to influence that 20%, but that we might be able to collaborate with others to influence that 80% also. I think a dominant narrative of health for many years has been something like that. It's been about professionals and hospitals and pills and tests and treatments. Of course, those things are just so important, aren't they, when we need them? But we are wanting to envisage a future of health that looks a little bit more like this. And we believe that through investing in the wider determinants of health, we can actually hopefully safeguard or even improve the quality and access to fantastic medical care, and at the same time reduce the environmental footprint of healthcare, try and improve health equity, and also try to improve the well-being of our staff, which is so needed, isn't it, during these tough times. So we started our work during the pandemic in Horley Primary Care Network. But soon our CCG, Surrey Heartlands, heard about what we were doing, and to our great surprise and delight, actually thought it was a great idea and wanted to see it spread. And so they then commissioned us to develop the work of what was started off as Growing Health to become Growing Health Together, working collaboratively across East Surrey Place with GP leads appointed in each of the primary care networks. And each of our colleagues, as we'll hear in a moment, have a very small amount of protected time each week to go out into their geographical footprint of their PCN and to work with others to create health. And rather than try to start with a one-size-fits-all approach that we would just universally put everywhere, a little bit like immunisation programmes perhaps, we decided to take an approach known as health creation. And the first step of that is around prioritising relationships. So allowing our colleagues to have time to connect with local people living and working in their primary care network. And that includes people like teachers, the council, faith groups, etc., as I've mentioned earlier, but also local citizens, and particularly those ones that we haven't always necessarily attracted into our patient participation groups. So I'm thinking young people, disabled people, people from minoritized ethnic groups. And then having built up trusting, respectful relationships, trying to listen to local people about what's already strong and working really well to support health and well-being in that area outside of the health service, such that we can connect more of our patients and allow the local community to connect themselves directly to it. And it was really quite incredible to me, having worked at Smallfield for 8 years. I've still been discovering new things, you know, almost every day that I didn't know that were happening on my doorstep, that my patients might have benefited from, but I was completely ignorant about it until I really had that time to go out into the community. And as well as hearing about what's working, we've then also been hearing, as I've mentioned a little bit, about what the challenges have been that are preventing people from improving their own health and well-being. And then wherever possible, rather than trying to jump in and fix everything in the traditional way that we tend to do things as doctors, we're actually trying to enable community-led responses to challenges that have been identified. Because research in health creation around the country, particularly by a wonderful organisation called C2, has shown that community-led responses can lead to really sustainable improvements in health inequalities over decades. But there are also instances where actually what's needed is more of a collaborative approach between service providers and citizens, and we've got many examples of that also. And so now I'll just run through a few examples of what that looks like in practice in the primary care network I'm most familiar with, which is Horley and Smallfield. And so in some of our community events and conversations that we're still having on an ongoing basis, one of the common themes that kept coming up was around disconnection. In the area, people felt disconnected from community life. People felt disconnected from the natural world, disconnected from food. And particularly certain groups, for example, the Portuguese community in Horley felt disconnected from the rest of Horley, disabled people felt disconnected, you know, etc., etc. So there are lots of more nuance to this overall theme. But some of the responses that we've seen develop over the past year also have included the establishment of a new health hub in the centre of the town, which not only has office space for Growing Health Together, our PCN and Federation, but also a large indoor community space that's being used by a variety of different groups, and a community garden, which is really coming into its own as the weather is warming up now. A new community fridge is coming in the next few weeks to try and reduce food waste and food poverty. And we've got a wonderful group of volunteers who are establishing a Men in Sheds group to help older men's mental well-being, with plans for a repair cafe. There are a real plethora of nature-based health initiatives springing up, including some led by carers and their children with learning disabilities, with opportunities for connecting with animals, growing vegetables, and more. We've helped to join the dots and enable the establishment of several new community-led wellbeing groups, including some that I've listed here, from English language speaking groups to peer support, and a women's group around financial support and IT know-how, Death Cafe, and then some work with Surrey Highways around active travel infrastructure, and just trying to highlight better the existing physical activity opportunities that exist in our area and respond to various barriers that have been mentioned to us about things that are preventing some people from accessing them. And then some really exciting projects around music making, actually. We've got several hundred asylum seekers living in our towns, and when we visited some of these wonderful people, we heard that they love music, they love rap and drumming, and we're bringing in some musicians with all of these instruments, and we've started to make music together, and it's been fantastic. Also an intergenerational music making project, which Richard is also doing, and I'm sure we'll speak about a little bit later on. And we've also, through having a bit of protected time, been able to contribute with a health lens to local conversations happening around regeneration of the town centre and how the built environment might best support health equity and sustainability. And many, many, many more projects, which I don't have time to go into now. Whilst we haven't prescribed every primary care network to follow particular themes, we wanted people instead to take a health creating approach. As you'll hear from the rest of the conversations, some key themes have emerged across all of our primary care networks. And the one that I'd like to just touch upon before I close is population health insight data. So we've been absolutely delighted to partner with SCW, who have been doing our baseline quantitative evaluation of growing health, utilising indicators based on the King's Fund population health model, which, if you've got really good eyesight, you might be able to see on this slide. And it's been really helpful to have that quantitative data insight to be able to triangulate with our own experiences working in the patch and the warm data, if you like, of the contextualized information that we're told in our human to human conversations in the local area. And this can really help us to ensure that we're taking this proportionate universalist approach that Sir Michael Marmot advocates, so that we're putting greatest resource in the areas with the most to benefit. And we will be doing a follow-up quantitative evaluation, but we've also applied to the NIHR for funding for a qualitative evaluation of our work. And in addition to this, we will also be doing some surveys, questionnaires on community connectedness, self-rated health, and also environmental indicators. So over the next year, we've got huge plans to continue to deepen the work that's already going on in our different PCNs, and then to work collaboratively with our ICS and wider system to try to facilitate even more opportunities for health creation. Thank you so much for listening, and thank you to all our partners. And I'll take that off. And now, Andrew, would you like me to go into speaking to my other colleagues, or would you like to introduce that part?
Well, no, do go around sort of each of the team, the colleagues here, yes, to say a few words about what's happening in each sort of locality and some of the reflections really on growing health together. Okay,
wonderful. Thank you so much. I'm delighted to start with Anna. Anna, you've been working in South Tandridge Primary Care Network, and I think you finally got the agreement to get going. Was it last November or October, something like that?
Yeah, last September, I think,
September.
was the official start date. So,
okay,
yeah.
Fantastic. Would you like to tell us about what you've been up to there?
Yeah, so the area I cover is, for people that know it, Oxted, Lingfield and Hurst Green. So my first step was to basically get out of the consulting room, like Gillian said, and go and just meet people, meet citizens, meet local key players, and find out what themes there were for each area to really work in a very sort of place-based manner. So one of the main themes that emerged across the board for all of the areas was just a massive rise in teenage and children mental health problems. So it's definitely something we were seeing more of at the surgery. And speaking to the patient participation group and to patients, it seemed like that was a real priority. Oxted School is one of the biggest secondary schools in the country, so actually some work had been done pre-COVID with the leadership team at Oxted School, but we rearranged a meeting and went in and had a chat with them, and it was very interesting to hear about their experiences and how really the teachers and safeguarding team, just like most schools in the country, I'm sure, were really being stretched, dealing with a lot of mental health problems in teenagers. So we had a look around the school, and one thing that jumped out was that actually the corridor, the rooms that were used for safeguarding, meetings with social workers, counselling, and children in crisis were really quite unfit for purpose, just very institutional sort of office type rooms really. And it seemed to be that it was a really big struggle for the teachers to work out of those rooms. So joining forces with school family and some of the school children, over the course of one of the school holidays, we transformed a couple of the rooms in a kind of changing room style fashion with a tiny budget from the PTA, just £200, and really made a massive difference, on the back of which we were asked to come back and do up another couple of rooms that could be used. And the impact from just, making those spaces more child friendly and more accessible for those meetings to happen in has been really incredible, and the stories that have come out of it have been amazing. So children who've struggled to talk about their issues with the teachers have finally found that they were able to open up more about their problems and move on with things. And the teachers have said, well, why now? What's changed? And they've sort of said, well, this, it's just, I just feel so relaxed. And I think it sort of shows people that actually they are important, and that they are cared for. A mural was done in one of the rooms by the designed by the children, with an LGBTQ plus theme, and I think the meetings there for that club now being held in that room, and it's been a fantastic project. Other ongoing projects are in Hurst Green. One of the local residents got in touch to say that they really felt that there's quite a rundown precinct in front of a row of shops, that really there was massive potential there to kind of make a more shared community space. That'd be a nice place for people to meet and to sit in. It's really well placed between the community centre and one of the local primary schools. So actually we've had a couple of preliminary meetings with a number of different stakeholders, and have the plans for a community courtyard, and we're hoping that we can really involve the local residents in deciding what kind of courtyard they want, and in the hope that then, you know, it will be well cared for and sustainable.
Thank you so much, Anna. And seeing all the connections that you developed over the last 9 months or whatever it's been has just been so inspiring. And I know you could spend literally an hour or more telling us about all the initiatives you're involved in. I'd love to hear, could you say just very quickly a few things about the wellbeing initiatives that you've spearheaded in your practice? Because that's also been really inspiring.
Yeah, so given the fact that community is made up of not only those people that live there, but also who work in the area, found that my practice was really receptive to some wellbeing measures, such as we've set up a lunchtime walking club. So twice a week we meet at 1:30 and walk from the surgery, with quite amused looks from lots of people seeing us all. You know, there are doctors, nurses, receptionists, admin staff all walking together to there's a local green space just around the corner, and also having a lunch club every couple of weeks. So we take turns in bringing in some food for our colleagues, and it's really, there's a palpable difference in, you know, everyone is bringing in healthier food and we're taking interest in what each other are eating. I think it has made a difference. And also we've now got a pacer group, which is a walking app, to try and all get our steps up. So it has made a difference to pull the team together and for our general well-being.
That's absolutely wonderful, Anna. Thank you so much. And now I'm pleased to hand over to Richard. Richard, you've been doing fantastic work in North Tandridge. Would you like to tell us about it?
Yeah, thanks, Gillian. Yes, being in a slightly fortunate position of when primary care networks were developed, and as Gillian mentioned earlier, they are quite an important vehicle for the development and delivery of our Growing Health Together programme. Being a CD, I was invited at the beginning of the primary care network DES to join our local community cafe and wellbeing centre as the medical advisor, which is known as the Westway, which is in Caterham in North Tandridge in Surrey. And they've been doing amazing work, great outreach team and a whole range of in-house activities. The manager that took over there around just shortly before I joined, her background was in the British Red Cross and a huge skill set. And so we then worked side by side on the Growing Health Together project and with C2, as Andrew's very kindly put the link to that in the chat, and went through a series of really constructive webinars with C2, which enabled us to develop a program called Joining the Dots, which was really focused on bringing together all of the good work that's been done over a long period of time by all the different agencies and organisations within our locality. So parish council, district council, the voluntary sector, and just really engaged residents, including our patient champions that work with us out of our practices through the Altogether Better programme, which was a facilitated programme that allowed us to bring enthusiastic patients into our practice teams to work alongside us on a whole range of health and well-being promoting activities. The work with C2, I think, has been invaluable, and we've got a whole range of projects that have been set up within our locality, which are really based on hearing what's needed from our population. Just one brief example. A local resident was talking to a group of young people, and they had bikes that had they'd been given for Christmas, for example, often from low-income families. Their bikes broke, and they didn't have the money. The parents didn't have the money to get them repaired. So we've been able to put together a project for training up some volunteers buying equipment, paying for the training, and we've set up a bike repair service, a free bike repair service for low-income families. In fact, we don't even say for low-income families, it's anyone that wants to bring a bike along and get it fixed. And that to me supports getting predominantly young people outside, getting healthier, doing all of the things that add value to our health, as Gillian was talking about earlier, with a very minimal amount of effort, to be quite honest, just enthusiastic people, and of course, a little bit of money to prime that at the beginning. And that's just one of a number of examples. Other simple things, again, a local resident came forward and said, I'm an expert in Tai Chi, and I actually understand that working with patients with Parkinson's disease can provide a benefit. So we've got a great community Parkinson's nurse. We're working with Parkinson's UK, bringing everything together to identify residents within our community who might benefit from that. It's an evidence-based intervention. If you practice any rhythmic movement with Parkinson's disease, it reduces your risk of falls, improves your balance and stability. So these are kind of evidence-based interventions which actually provide improvement to health and well-being. A whole range of other things, working with other organisations, including our local leisure centres. They're running, they started up, we were working with them together on something called a Friday night project for 6 to 16-year-olds, which was really activity based. And on the first Friday, about 10 weeks ago, when it opened up, we were expecting about 20 young people along, and 96 arrived on day one. And now there's a waiting list and parents are saying, why can't we get our children in there? It's basically just 3 hours of activities, etc. And that's feeding into a wider piece of work, looking at those that have perhaps limited access to getting outside, physical activity, and even interacting with others and taking part in sport. The Surrey Youth Games is coming up next month, and a lot of younger people are being encouraged and helped to do the things they want to do in a very supportive and not particularly competitive or aggressively competitive way, just again to help promote health and well-being in young people. Going back to Anna's point about the massive epidemic that we've seen of mental health problems in young people and adults.
Thank you so much.
So that's enough, I think, from me. I could go on, but I won't.
I know that you could, and there's just so many of those initiatives that Richard's just shared that, like Anna's, we want to bring to Horley Primary Care Network, because there's just, you know, so much there, wonderful work going on. And likewise in Redhill, under Dr. Uzma Aziz, I'd love to hear a little bit more about what you've been up to recently, Uzma. You're muted.
Sorry, can you hear me now? Yes, thank you, Gillian. Redhill, as you know, that we started working round about September time. I think we met around, I met different people from different organizations, made connections. I think Redhill West Partner Network is, I've been working in close collaboration with them, and they've been working very actively to help the people of Cromwell State, which is a very deprived area, and it comes very nicely into addressing health inequalities and basically what was needed by those people to help with them. I think also the other important thing, I think the population of Redhill is quite a lot of the South Asian population. So there was a need to connect to local mosques, to the other people. So I think we tried to meet the local leaders and tried to persuade them to have some, because we know that diabetes and obesity and all these problems are quite a lot of, and the cardiovascular diseases are very common in these people. So we involved them, and we've tried to organize the sessions with them so that we can organize health talks. Also, I think on the same level, there was talk about the maternal health outcomes are very poor in this area. So I made connections with Happy Baby Community, with the East Surrey network, and I have it has been very good connecting with them, because I've been able to deliver some talks with them, kind of a listening session where I was able to connect with the asylum seekers, and we just delivered some health talks on cervical screening, on sexual health education, and it has been very valuable, because we asked people to write on the paper if they didn't want to say something in public. So it was kind of a listening event as well. On the same note, I think, so if we go to other projects that are going on in Redhill, working with Redhill West Partner Network, a communal gardening project, which was very interesting. That is, they involved the people of the local area, went door to door, knocked on them and asked them what they wanted to grow in that area. So that was a very good example of involving the people, what they wanted to do. And the people said they wanted to grow herbs, and hence it is planned that they are going to use a small part in observatory walk in Cromwell area to grow the herbs. And this is what they're going to do, and the project is going to start. They want to just tidy it up and make a nice green space for people to visit, because there's no bench. They're planning to plant flowers in there, put a bench in there, make the process, the path clear for them. And there are some people who have had learning disabilities. They've involved the population, and they've been involved in litter picking, which has helped and clean. So it has helped clean the paths in that area. Other than that, I think in collaboration with Redhill West Partners Project, there is a lot going on. We collaborated, in fact, Autism Friendly Community, they collaborated with us, and I think there was a need to increase awareness in the frontline staff, reception staff in GP surgeries, in leisure centres, gyms, etc., so that they have a training to understand and pick the sign of autism and how they can deal with it. So we've been able to organise training for them. And the one training and the launch event went very successful. There is, sorry.
I'm so sorry to interrupt you, Uzma. Thank you so much for sharing all of those. And I'd love to hear more. But one thing I'd like to ask that we haven't quite covered yet would be this, if you don't mind just saying a few words about what you have enjoyed about being part of this. It's obviously really different, isn't it, to our day job as GPs? Really, really different. And I just wondered, what have you enjoyed, or what's been difficult, whatever you'd like to speak to then. I think we've got about 1 minute left before Angie would like us to go back to Q&A. Is that right?
Right. I think the best part of this is I have enjoyed connecting with the people, right from the colleagues to the voluntary organisation, to the asylum seekers. I have connected on each level, and I have learned a lot from it. Also, I think knowing when we're sitting in our places, as you said early, we don't know what's around. So things like be your best self, things like Basra, these are very valuable informations. I think it's kind of a learning curve for me as well. There is so much going in the community, and just by connecting them together, we can achieve a lot. Because I mean, a simple example is I have interacted with SMEF and an outreach mental health worker from there. We have
Surrey Minority Ethnic Forum. For anybody that doesn't know.
Minority Ethnic Forum. So together we are working. So from a mental health outreach worker from there, we've been able to connect him to local mosques, so he can organise talks about mental health awareness, and also to WellCare Centre. And with SMEF, we are connecting. So with SMEF, we're working on improving maternal outcomes as well. So I think connecting has really, I mean, it's so important to know that there's so much going on in the community. Just by connecting, we can just achieve a lot. And also, I think it also, it's kind of a general practice. We're seeing a breadth of issues, right from pediatric to elderly population to mental health and to health disabilities. What I like about Growing Health is that it involves everything about it. So we can work right from green spaces to work on mental health to financial, helping them with their financial issues, help them with the aid. So there is such a breadth of issues that you can cover. And also, I think over the last 10, 12 years working as a GP, we've always, when you're handing over a prescription for antidepressant to a mental health patient, or you think that there is much more you could do when you go out there. So you know that this is not going to solve their problem. So as you said initially, wider determinants of health, acting on them and working on it collectively, how much we can help and save the NHS. And of course, certainly Growing Health Together has given me a platform to work on that.
Yeah.
Thank you so much. We're so lucky to work with you as well on it. And to Richard and Anna and to Bassam. Thank you.
Thank you for that set of contributions. That's such a diverse and rich set of activity and initiative that's happening in the area. Just to say, actually, if I could ask the panel to remain on screen, but can other colleagues come off screen so we can just focus on the panel? I think Logie, I think you may still be on camera. Thank you. That's appreciated. So we got a lot of questions and comments in the chat. We've got a bit of time to go through some of them. So one of them, of course, is about, I think, getting started, as it were. We've seen a few comments about saying, why is this isn't happening here? This would be great to happen in this area. So one question is, well, basically, how do you make a start? And how do you fit it into your very demanding clinical day jobs? Who would like to pitch in on that?
Shall I take that one?
Yeah, because you can. Yeah.
So in case anybody missed the slides that I gave earlier on, I would just say start small, think big, move fast. That's been our kind of motto. And so it really started in Horley, just conversations between Michael and I, another GP, and then involving a chief executive of a federation, and then speaking to 12 head teachers. And then it just sort of gets bigger and bigger and bigger, because each person you speak to is connected to another 100 people who might be interested to work with you on it. So it started in a very grassroots way, not with a plan and strategy, but with relationships, as all of my colleagues have emphasized. And I think because of the pandemic, it was difficult actually to progress things in a purely grassroots way. And when the CCG then invested and said, OK, you can have one session per week, so a half day per week in each PCN to develop this work, that was when we really had the capability and also the authority in some ways to be able to say, actually, our CCG is investing in this. This is evidence-based, etc. And I think that really helped accelerate our work. And they also asked us to deliver an education program, which, as Richard said, we did in collaboration with C2. So that provided us with the springboard and the knowledge of the approach we wanted to take. And we're now hopefully going to be collaborating with the Health Creation Alliance, who I think are on the call today, for wider training across the whole county in this field, because it's recognised how valuable a health creation approach is. But I think starting small rather than trying to, design something really complex would be my best advice. I don't know if anybody else would like to chip in there.
I was just going to add, I think it's absolutely fine to have a go at things. You don't necessarily need to write a business case to do the small things that we're trying to do. And as we kind of often say, some things will be successful and you go with those. Not everything will, but doesn't matter. You're just you're listening to the people out in our communities and saying, yeah, let's give that a go.
In a sense, it is about just making a start, isn't it? Starting small, listening, connecting, and building from there. What I've been struck by is the diversity, as it were, of initiative and activity, and that reflects the fact that you're responding to essentially the priorities and the interests of local communities. You haven't got a set idea, you haven't got a fixed idea about what to focus on, and and that's very powerful. It can mean it could be quite challenging to measure and evaluate, so that's another question, but it's really powerful to have that responsiveness. So that sounds like you've had a supportive environment and some funding from the CCG stroke ICS, and there was a couple of questions there that relate about that wider sort of context around what, have you had input or buy-in from other NHS organisations, not just the CCG, but the acute or mental health or community trusts? What's been the involvement maybe of the local authority, for example, either district or county council level? What's the picture in that respect?
Shall I take that one as well? Because I'm the one that's mostly involved in a lot of those things. So to start with, it was kind of on a case-by-case basis in our different areas. Some councillors might be involved, for example, local councillors, and others might not be. But as time has gone on, and we're now over 12 months in, we're starting to sort of systematically ensure that we're joined up at every level throughout the system. So we are joined up, for example, with our ICS as well as with our CCG and our Health and Wellbeing Board and our public health colleagues and our social care colleagues and our social prescribers, etc. And we're not only trying to connect with them at the sort of board level, but actually at the practical geographical PCN level, so that we're having join-ups with our local midwives, social workers, social prescribers, community development officers from the district and borough council, and all the teachers, for example, and so on, so that we've got that connection at every level. And it's been, I think the county council were particularly fast to support this way of working because it aligned with their priorities, which are health inequalities, climate change and a strong economy. And so the work that we were doing supported what they wanted to do. So that was very helpful early on. But now essentially everybody wants to join up with us, and we're just getting along and doing that, really.
And there is a question there about funding, financial support from other sources, e.g. the local authority. It sounds like you probably have you had some financial support from the county council?
We haven't had any financial support directly from the county council, I don't think, although I hope I haven't forgotten something. But because they're merged with Surrey Heartlands as an ICS, essentially it is the same organisation anyway, and I think that's why their priorities were so aligned with our own. But they're absolutely key partner, as are the districts and boroughs and so many others.
Yeah. Okay. So just going through some of the other questions there. I mean, there's one around. I mean, it's great that you are taking a lead as GP leads, clinical leads, directors on this programme. But what's been the involvement and engagement of your non-clinical team members in the programme? Obviously, you've talked about social prescribing. You'd expect to be quite active, but what about other staff, maybe reception staff, back office staff? Is there wider engagement from across the primary care team?
Richard, I'd love to hear you talk about Amanda John Lewis, and Anna, I'd love you to hear about. Oh no, it was Radhika who was telling us about one of their reception staff and how they've taken a lead in this. But maybe start with Richard, and then Uzma and Anna might like to join in.
Certainly. Yeah, thanks, Gillian. Yeah, I think I mean, again, with our primary care network, we have a monthly board meeting, and Growing Health Together is a standard agenda item on there, a standing item, and so we discuss and socialise that amongst the board. Has that filtered down to everyone working within PCNs? I would say not, but I think the hope is that the work that we're going to do with the Health Creation Alliance will get some champions coming into PCNs, and then that will help to bring in more individuals who understand the concept. I think everyone, as we probably understand, is still firefighting a bit and catching up post-pandemic, but we have got some really good work going on, and one of our link workers from our PCN was actually the individual who initially spotted intergenerational music making, which is what Gillian mentioned earlier. That's basically where children and young people work with care homes. This is evidence-based intervention, again, through South Bank University and their research, and IMM have set up projects. This was all brought together by Amanda John Lewis, who's one particular individual working within our PCN. And now I've seen it go live. We've got 2 nursing homes and to schools locally, and a course where the students and young people go in and make music with older people. And as I say, in terms of social skills, confidence, and for older adults, especially those with cognitive impairment, the evidence base is clear to see. So that intervention came about as a result of the enthusiasm of one individual, and has turned into a fully funded project, which is really exciting. So more of that, the better.
Great, great. And that is great to hear that it's across the sort of team. You've got the opportunity for people to pursue, you know, their sort of aspirations and input beyond perhaps a narrow sort of job description. That's great. There's an really interesting question here from a colleague in Isle of Man about some local developments there, but it's essentially the question is it advice for bringing along GP colleagues into this more social and wider sort of upstream care model, and essentially away from a purely medical model. So that's quite a challenge. You're obviously quite taken and committed to health creation as a concept, but what would you say for areas where there's a bit of resistance or skepticism about this approach?
Anna or Uzma, would you like to speak to that?
Yeah, I'm happy to answer that one. I think I agree. Now for 20 years, and I think a lot of our work is very transactional, short-term, target-driven. But I think it's actually, you know, health creation. It's sometimes a slightly difficult concept to understand in terms of, you know, this is not it's getting away from telling people what's good for them, and it's more working in an equal partnership to find out, you know, what makes people healthy. And I love the slide that Gillian used, the wider determinants of health. I think that really goes to show that actually, you know, I think doctor surgeries feel this massive responsibility to make people completely healthy, but that just shows that really we can't do everything, and how important all these other factors are. So I think just, you know, it's such a positive, fresh outlook really that I've found in my experience. Actually, if you talk to people and explain that you know, colleagues have been very receptive on the whole to seeing that maybe there is a slightly different way of doing things, but it you know, it's going to be long-term outputs, which is different to what we're used to.
Yeah, I mean, in a sense, it's part of a wider movement, isn't it? I mean, there's a whole history of community-based approaches to health improvement, isn't there? And health inequalities, health creation, as well, has been around as a concept for some time. What I think is really strong and powerful about Growing Health Together is this really strong commitment and input and energy from within primary care, and that's happening in other parts of the country, like in Fleetwood, you know, in the Mendips and in Frome, for example. You've got pockets and areas where primary care is at the heart of this community-based approach, but equally other areas where that's less so. And an interesting comment or question here from Hasham, I think at the Confed, which is about you know, thinking about, you know, the sort of policy impact of this kind of work. What would you like to see, as it were, from you know, sort of government policy, the OHID, Office for Health Improvement and Disparities white paper, that would support, as it were, this kind of initiative further? Any sort of policy or government, you know, intervention, or would you rather they just sort of keep out of it?
I guess there's two roles, aren't there? There's the role of government in creating a health creating society, and if anybody hasn't already read this book, Health is Made at Home, Hospitals are for Repair. Sorry, it makes me disappear, you can't really see it. Anyway, by Lord Nigel Crisp, Health is Made at Home, Hospitals are for Repairs. And he talks in there about how we all, thank you, Richard, excellent, we've all got it. He talks there about how we've all got a responsibility, whether, you know, we're a school child, we're at the end of life, whether we're in the government, we've all got a responsibility to create conditions for health and well-being. And so clearly that might be responding to the cost of living crisis, responding to the climate crisis as a national kind of approach. That's really necessary, but also enabling that principle of subsidiarity and allowing clinicians who are closest to problems isn't the right word, but closest to the ground, they're closest to the solutions of whatever issues might be arising there, and they're best placed to understand the capabilities and assets of that place to be able to, you know, cultivate conditions for flourishing. So enabling local areas to lead, and clinicians, you know, of all different backgrounds and are not to be able to lead solutions that they can see, I think is really key. That's probably not succinct enough answer for you, Hashem, but thank you for the question. I don't know if any of my other colleagues would like to contribute to that.
I just would like to say here that although yes, we know there is, it's a very slow process, and at the moment it is difficult to prove it, but there's been evidence from C2 communities and the work that's been done in Exeter to say that how health creation can change the outlook, and how did it involve the teenagers, and how to prevent them from antisocial behavior involved in certain activities. So I think as we go along, there will probably be more and more evidence for government to put budget into it, because we can keep pumping money into NHS, but unless we act on wider determinants of health and give people the opportunities for health creation, I think it will be very difficult to keep going with the current model of care that we are providing.
Absolutely, yes. And Gillian, are you just agreeing, or do you want to comment?
I would. Thank you so much, Uzma, for saying that. That's so good, and it reminded me of something that I should have said, which is that ring fencing NHS funds for prevention, and also shifting away from the 12-month cycles, which we're currently utilising even for prevention, towards something longer term would be so beneficial for planning purposes and to ensure sustainability of this kind of approach.
Yeah. So with that, we're very close to 2 o'clock. So I want to thank you all, to Uzma, Richard, Anna and Gillian, for joining us today and giving your time. I think colleagues, attendees here, I think it looks like they've really found this an inspiring and very positive time to hear about growing health together. I think it sparks a lot of interest and ideas about how to expand and build on this approach. As I say, you know, there's a lot of this developing, but it feels like it's reaching a critical mass where community-based approaches, putting people first. There's a lot of people like New Local, Health Creation Alliance, C2, Catalyst, and many others that are really active in this space. And I think we look forward to the OHID white paper, but ultimately this is down to people essentially taking more control and moving away from a medical model. And responding really to local priorities and local needs and working together. So I want to thank everybody for joining. We have recorded this event and we'll be sharing it on our website. So I think we'll be able to publish that out to you all. In fact, I don't know if a colleague could put our website up quickly, but thank you everybody, and hope we can join with you again in future for this kind of event. Thank you. Goodbye.
Thank you.
Thank you.
Thanks for having us.
Thanks very much.
Thanks.
Bye.
Bye-bye.
Bye.